The Hippo tool is an absolute differentiator. It brings an acute solution to an acute problem. So rather than waiting however many weeks for a patient to get to a specialist or a primary care physician or to the emergency room, we can respond and hopefully avert a deterioration of that patient through the use of this technology. It's true bedside care. It's extending that specialist and my own capability outside of time, distance of delivering that care.
Hippo has played a very large role in our ability to increase the quality of care that we provide here in the facility. Using this equipment has allowed us to keep more residents here in the facility where they live. This is their home, surrounded by their friends and caregivers that know them better than anyone.
So the device has definitely helped us reduce our in and outs, our trips to the hospital that are unnecessary and that can be extremely taxing on our residents. So now they have access to these providers who can triage them and treat them digitally.
Being 9 months pregnant, I'm having to take some steps back from being in the facility every single day. I'm able to use the Hippo as my eyes and ears on my medical assistant, the continuity of care of me continuing to be able to see them. That's been a huge game changer.
It makes it a whole lot better for me to have my nurse practitioner right here on site with me. Her body may not be here, but her voice and her spirit and her face is here. So yeah, it makes it easier.
It allows us to extend our skill set to folks that don't have the same skill set, but are capable of providing quality medical care at our direction. It will help those folks to develop in their ability to treat people.
The technology has definitely improved all of our jobs. The device is extremely user-friendly. It's very simple to use.
You log in on the computer, scan a barcode with the device, and then you have a list of events, and so you can pre-schedule appointments or telehealth visits that way.
The headset is voice activated, and all the commands are incorporated into your visual field. You can access the medical records. You can pull up old comparative images. You can gain training videos. So there are a number of supportive elements to it.
One thing that I definitely noticed immediately once we started utilizing the equipment, we identified a lot of our hospitalizations and our discharges that weren't necessarily needed were occurring after hours and on the weekends. Being able to prevent those hospitalizations does reduce cost. We've been able to maintain our census. We've been able to reduce transportation costs by being able to keep them here in the building.
It is a product that allows for all of these elements to coalesce at the point where the patient is in their circle of care, wherever that bedside is. And Hippo does that.